Mr. John. Hello, my name's Curtis. I'll be your nurse today for the next 12 hours. How are you doing today? Doing good? Sounds good with me. Can I have your name and date of birth, please? Alright, that sounds good with me. Alright, John, I'm just going to ask you a few questions. Do you know where you are? Okay. Do you know what day it is? Okay. Do you know who the President of the United States is? Alright, sounds good with me. And then just one question to test your judgment. If it was raining outside, what would you be wearing? A coat? Alright, sounds good with me. Okay. Alright, are you in any pain right now on a scale of 0 to 10, with 10 being the worst pain you ever had and 0 being 0? No pain? Okay. Feeling pretty low? Out of 3? Okay, sounds good with me. Alright, I'm just going to be checking out, doing a head-to-toe assessment, Mr. Jones. Just making sure you're all looking healthy and fine, and making sure there's any lesions or any abnormalities of your body. So I'm just going to go ahead with my assessment. Alright, so I'm going to go do my blood pressure check and do the vital signs first. I don't know if this is phago manometer, but I'll be doing checking out the blood pressure. And it looks like the blood pressure is 152 over 90. It's okay. And that's pretty high, but I can check the orders and medications later to see if there's any blood pressure medicine to maybe lower that down, or ask the doctor what the call orders are. I'll be checking the pulse. I can check the the radial pulse and the ulnar pulse if I want to. And it looks like the pulse is about 77, which is within the normal range. And then I'll be checking the respiratory rate, just watching how many breaths the patient does per minute. Mr. Jones has 12 right now, so it's in the adequate range of 10 to 20 breaths per minute. And then there's usually a temperature probe somewhere on the wall, where I can get one of those temp probes and just check it orally. If they can't, I can do axillary. And it looks like their temperature right now is 100.6. So it looks like it's almost a low-grade fever, which is a little concerning, but I can check up on that. And I'll be checking that heart rate. I'll check apically with my stethoscope. I'll do it later. It's about 79, so still within normal range. And it looks like their oxygen level is 91. Low 90 is still okay. I'll have to check the call orders to see what the oxygen is, to see if I need to put patient on any oxygen or additional FiO2. Alright, so I'm going to check the body, see if there's any IV lines, and I see one that there is an IV line right here. Or no, there isn't. But there is a line. Goes here. I'll be checking the other hand, seeing anything. I'll be checking the skin, checking to see if it's warm. It is kind of warm on this side, on the left side, and the left forearm. I'll be checking the cap refill while I'm here on the fingers, just to see if the blood's circulating through the body. Check it over here as well. You usually just check it for a few seconds, just press it down with the thumb, make sure it's blood flow. While I'm there, I can also check the cap refill on the big toes and the little fingers. Alright, I'm checking on the head to make sure there's any lesions. Checking the ears as well. Checking to see if the eyes are symmetrical. Checking the nose as well, seeing if it's patent ears. I'll be doing pearl as well. Pupils are equal to your actual light. They're round. I'll be doing the test. And I can ask him to do the 6 cardinal gazes test as well, just to see if he can accommodate to my pen line. Can you open your mouth for me, Mr. Jones? Checking to make sure, see what the dentition is like. Seeing if there's any, I can check the uvula and see if that is still intact. Checking the tongue, seeing if there's any moisture. Seeing if there's any obstructions back there as well. And then, I'm done with that. Alright, and then I can go ahead and proceed, just checking again, all extremities to make sure, if there's anything abnormal about my patient. Sure, just checking, seeing if he went to the bathroom so I can clean him up or anything. Make sure. So good, while still providing him privacy. I'll just be going through a simple, cardiovascular check. Doing ape to man. as I check the apical pulse, I can hear it. I'll now be doing a respiratory check. Just listening to what those lung sounds are. I can now also like inspect the abdomen and seeing, checking those bowel sounds. Checking first in the right lower quadrant. And then I can like palpate, ask him, is he in pain in those areas specifically? Then I can do range of motion tests to see if he can flex, extend, dorsiflex all his different extremities. And then other things we do is like test his neural reflexes to see if he can feel pain and sensation in each part of his body. And then I'm gonna finish up with doing like a grip strength test as well. Make sure he's still pain and strong enough, so see if he can go against resistance. All right. And that is my head-to-toe assessment for Mr. Jones. Thank you for your time today, Mr. Jones. I'll be around today.